summers ago, when I was teaching gross anatomy to our physical therapy students, one of the young women in the course, I'll call her Kate, woke up one morning and her roommate noticed that the muscles on one side of Kate's face appeared paralyzed. When Kate smiled, it was only the left side of her face that moved. She couldn't close her right eye. And when she tried to drink some water, it dribbled out of the right side of her mouth. The roommate worried that Kate may have had a stroke, but Kate could still open and close her jaw, and she had full feeling on the skin of her face. Only her facial muscles seemed to be affected. The two roommates missed class that morning to take Kate to the emergency department. Coincidentally, this all happened right around the time we started covering the head and neck section of our course. Let's take a look at the muscles and nerves of this area and then see if you can diagnose Kate's disorder. As we know, cranial nerves control most functions in the head and neck, so it might help to start with a list of the 12 pairs of cranial nerves, since they supply most structures in the head and neck. Cranial nerves are designated with Roman numerals 1 through 12 as they come off the brain from anterior to posterior. Cranial nerve 1 is the olfactory nerve, 2 is the optic nerve, cranial nerve 3 is the oculomotor, 4 is the trochlear nerve, cranial nerve 5 is the trigeminal, 6 is the abducens nerve, 7 is the facial nerve, 8 is the auditory nerve, also known as the vestibulocochlear, cranial nerve 9 is the glossopharyngeal, 10 is the vagus nerve, 11 is the spinal accessory, sometimes just called the accessory nerve, and cranial nerve 12 is the hypoglossal. There are several memory devices for knowing the cranial nerves in order, but one I like is, on old Olympus towering tops, a Finn and German viewed some hops. We won't cover any great detail on all the cranial nerves. I'll focus mainly on those that control muscles. There are a surprising number of small muscles throughout the head and neck. For example, there's a set of 6 muscles in each eye orbit, the socket containing the eyeball, which move the eye in complex patterns important to our sight. These are muscles of great precision, but obviously of little strength, since their only job is to accurately coordinate movements between the two eyes for optimal vision. Some of those muscles have an entire cranial nerve dedicated to them. In fact, of the 12 pairs of cranial nerves, 2 of the tiniest ones are solely devoted to controlling a single eye muscle each. Cranial nerve 4, the trochlear nerve, and cranial nerve 6, the abducens nerve. Another cranial nerve, number 3, the oculomotor nerve, controls the other 4 muscles that steer the eyeballs, as well as the muscle that opens the upper eyelid. And while interesting and important, these so-called extraocular muscles are typically not a major focus of a musculoskeletal course. There are also numerous tiny muscles within the soft palate. That's the fleshy portion of the posterior roof of the mouth, and many other muscles within the walls of the throat. Together, these aid in the voluntary phase of swallowing and in opening the eustachian tube to help equalize pressure in the middle ear, like when we're subject to altitude changes in a plane or a car going up a mountainside. There are also many small muscles associated with the larynx, commonly called the voice box. These aid with breath holding and sound production. The vagus nerve, cranial nerve 10, supplies most of these small muscles. In the neck are a group of suprahyoid muscles that connect the hyoid bone to bones of the skull, and a group of infrahyoid muscles that connect the hyoid bone to the sternum, larynx, or even pectoral girdle. The suprahyoid muscles elevate the hyoid bone and larynx during swallowing, and the infrahyoid muscles depress the hyoid bone and larynx. And most of the suprahyoid muscles are supplied by cranial nerves, but the infrahyoid muscles are more inferior in the neck and are supplied by nerves of the cervical plexus, a group of ventral rami off spinal nerves C1 through C4. Also important to swallowing and speech, the tongue is essentially a group of muscles covered by mucous membrane, peppered pun intended, with taste buds on its superior surface. The intrinsic muscles of the tongue give shape to the surface of the tongue, and extrinsic tongue muscles move the tongue in and out and left and right. Some muscles of the tongue originate on bones of the skull, like the mandible or temporal bone. Others take origin off the hyoid bone. Most muscles of the tongue are controlled by cranial nerve 12, the hypoglossal nerve, as glosso means tongue. The two tiniest muscles in the body are inside the middle ear cavity, the tensor tympani and stapedius, and are attached to two of the small ossicle bones in the middle ear. These muscles aid hearing, as when the tensor tympani muscle contracts to protect us from many loud sounds. The middle ear is a tiny chamber, an air-filled space that would hold just a few drops of fluid. But despite their close proximity, these two muscles are each supplied by a different cranial nerve. The intricacies of cranial nerve distribution relate to the complex story of animal evolution. And while I cover the many small muscles of the head and neck in my graduate level gross anatomy course, I don't cover them in my standard musculoskeletal anatomy course. This is because these skeletal muscles produce no or very little outward observable muscle actions. In my opinion, among the most interesting muscles in the entire body are those that create our facial expressions. These are pretty unusual as muscles go, since while they originate on bone, most muscles of facial expression insert on the skin. So rather than moving bones, these muscles literally steer the skin of the face around to result in a vast array of intricate patterns. If you think about it, you can often tell what someone is thinking or feeling without them saying a word. These complex facial expressions are fairly unique to primates and are most well developed in humans. While your dog can pull back the corners of his mouth and expose his teeth to snarl, he doesn't have the nuances of facial expression around the eyes, the forehead, or the mouth that you have. There are characteristic maps of human facial expressions, and many of them are universally recognized around the world. Looking at these, you immediately get a sense of whether the person is surprised, puzzled, angry, disgusted, sad, or happy. And as strange as it seems, these facial expressions are solely due to the movements of facial skin. A moving skin might seem odd, but maybe you've seen a horse, for example, shaking the skin of her back to deter flies. These movements of facial skin are similar and are seen to varying degrees in different mammals. You may have never thought of nonverbal communication as a function of skeletal muscle, but I find that so interesting. There are several main groups of facial muscles to consider. Some muscles of facial expression are associated with the forehead and the eyes. There's a group around the mouth and some odds and ends between. And as a group, all muscles of facial expression are supplied by cranial nerve 7, the facial nerve. See, occasionally anatomical names do make perfect sense. But the trigeminal nerve, cranial nerve 5, provides sensations from the face. The name trigeminal implies its three main branches, and each one supplies sensations from a portion of the face. Its ophthalmic branch supplies skin of the forehead and down the nose, mainly by its supraorbital nerve. The maxillary branch supplies skin of the cheeks by the infraorbital nerve, as well as being sensory to the upper teeth. And the trigeminal's mandibular branch supplies skin of the chin and lower face, mainly by the mental nerve. And it's also sensory to the lower teeth. Now, these come out the supraorbital, infraorbital, and mental foramina studied in our previous lesson. If any of these branches become inflamed, a person can have excruciating pain from one or more regions of the face. So facial skin is covered by a different cranial nerve than our facial muscles. Textbooks and other sources invariably list different collections of these facial muscles. And in this case, not only is the naming of these a human construct, but in my opinion, even the differentiation of them into individual muscles is a human construct. When we look for these muscles in the cadaver lab, we essentially have to shave the skin off of a fairly continuous sheet of subcutaneous muscle. So to see the muscles of facial expression, you have to literally remove their insertion, which is the skin, in an effort to try to discern their small, flat muscle bellies. And although most diagrams make these muscles look like discrete entities, that is deceiving compared to the experience in lab. What we really look for is directionality of fibers. You see swirls and swoop-like patterns of muscle grain, and anatomists have given names to those patterns to differentiate the groups of fibers that cause certain functions in facial skin. So keeping in mind that a sketch of these muscles is really pretty unrealistic, let's look at some facial muscles and how they're named. Also, remember that the grain of a muscle helps reveal its action, since muscles shorten to do their work. Let's start with the complex around the eyes. The frontalis muscle runs vertically within the skin above the eyes and wrinkles the forehead. The corrugator supercilii, a supercilii name, but cili is used to refer to some structures of the eye. This muscle draws the eyebrows together, wrinkling or corrugating them. A circular muscle called the orbicularis oculi, an orb-shaped sphincter-like muscle, encircles each eye. It causes squinting when we use the peripheral fibers, but causes blinking or closure of the eyelids when we use the portion within the eyelid. Around the mouth, we have another circular muscle called the orbicularis oris, from oral meaning mouth. It's the muscle that puckers the lips. Along either side of the nose is a vertical muscle called the levator labii superioris. Its name tells us that it elevates the upper lip, since labia means lip. It's the snarling muscle that Elvis Presley could use to hike his upper lip unilaterally. Remember, that means on one side. The risorius is a horizontal muscle that can pull the corners of the mouth posteriorly. These two, levator labii superioris and risorius, fuse with the edges of orbicularis oris. So not all of these muscles insert on the skin. Some actually attach to each other. Two other muscles that relate to the orbicularis oris include the zygomaticus major, which is our smiling muscle. It originates from the zygomatic bone at the prominence of the cheek and passes inferomedially to fuse with orbicularis oris. Its counterpart is depressor anguli oris, a name that means to depress the angle of the mouth, as in frowning. Again, looking at these muscles reinforces how their directionality relates to their function, since muscle fibers shorten to act. Inferior to the mouth is mentalis. It's a deeper muscle that protrudes the lower lip, as in pouting. Another deep muscle associated with the oral region is called the buccinator. Now, some people say buccinator, but as I often say to my students, ask your aunt or aunt how she says it. Often the way we pronounce an anatomical term relates to how we learned it from our own teacher. One of the guys I taught gross anatomy with was also a Greek and Latin scholar, so I try to stick with his pronunciations. Anyway, the buccinator muscle is interesting in that it is contained within the cheek wall. If you place your finger on the outside of your cheek and then move your tongue inside your mouth to reach that finger, the buccinator muscle is between the skin your finger is touching and the inside of your cheek that your tongue is pressed against. The buccinator is the muscle that we use to draw in our cheek wall, as in sucking through a straw, or to compress and expel air within your oral cavity, like when blowing a trumpet. In addition, the buccinator is important to eating, since along with the tongue, it helps continually reposition food for chewing, instead of having food get stuck in the furrows between our cheeks and gums. I should mention that over time, these facial muscles can result in skin wrinkles. So injections of the botulinum toxin, commercially called Botox, can temporarily paralyze them. While this can erase wrinkles in the short term, it can also give an unnatural facial appearance because the nuances of facial expression are lost. Before leaving the muscles of facial expression, there are a few remaining members of this group that are not really associated with the face at all. One is the occipitalis, which is like a horizontal band at the very back of the scalp. Surprisingly, it's actually connected to the frontalis muscle of the forehead by a broad, flat tendon called an aponeurosis. And that tendon is one of the layers of the scalp. So despite its position, the occipitalis is part of the complex of subcutaneous muscles supplied by the facial nerve. An additional muscle, the platysma, is within the skin of the neck. Sometimes it's called the shaving muscle because it can tighten the skin of the neck, as may be done while shaving. Like occipitalis, platysma is also supplied by the facial nerve. Humans also have auricularis muscles deep to the skin around the ears. Now, cat, dog, and horse lovers may recognize how these muscles move and rotate the ears of those and many other mammals in the direction of sound. But in most people, the auricularis muscles are vestigial remnants of our animal evolution, though I'll bet each one of you knows somebody who can wiggle their ears. If so, they're doing it using their facial nerve. Estimates of people who can wiggle their ears range between about 10 to 20%. And get this, some sources say it's a teachable action. So there's a life goal for you. Another group of important head and neck muscles are the muscles of mastication. Now that's a fancy word for chewing. These four pairs of muscles operate the only diarthrotic synovial joints in the skull, our paired temporomandibular joints. As we learned, these are joints between the head or condyle of the mandible and the mandibular fossa on the temporal bone. By shape, they're combination hinge and gliding joints. Hinge for the opening and closing action, and gliding when talking about side to side and front to back actions. A cartilaginous disc between the bones aids in keeping the mandible in place by deepening and cushioning the mandibular fossa, while the articular tubercle on the inferior aspect of the zygomatic arch helps keep the mandible from anterior displacement. Now, when you think about it, gravity can open the jaw. And when I say this, I fondly remember my father asleep in his chair with his mouth hanging open. Fortunately, students who fall asleep in class usually just put their head down on their desk. And regarding cadavers and others in eternal rest, most people don't realize that it's often part of standard embalming procedure to wire the upper and lower jaw together. The cadavers we use in anatomy are utilized twice for teaching and learning, so we see evidence of many standard funeral practices in the lab. First, the cadavers are used for teaching mortuary science students to embalm, and then the bodies are transferred to labs where they're used to teach anatomy. When we cover head and neck anatomy, students are often surprised to see a small screw in both the upper and lower jaw and a loop of wire holding those two screws together. This is an important funeral practice, since at an open casket visitation, no one wants a deceased friend or relative's mouth to gape open. That would not be good. So back to the muscles of the jaw. Two paired muscles that help us close our jaw and clench our teeth are the temporalis and masseter muscles. The temporalis sits on either side of the head at the temple, hence the name. And if you clench your teeth, you can feel it tensing. The masseter is more associated with the mandible itself. And if you put your fingers on the sides of your jaw while you clench your teeth, you can feel it work. The temporalis has a broad origin along the temporal lines on the side of the skull, and it inserts on the coronoid process of the mandible. The masseter originates along the zygomatic arch and has a large insertion along the lateral ramus of the mandible. These are both powerful muscles, and in some primates, like the gorilla, The temporalis muscles are so well developed that there's a crest on top of the skull, the sagittal crest, where the temporalis muscles anchor superiorly. The sagittal crest isn't only found in gorillas, which are primarily herbivores, but also in some carnivores, like some dinosaurs, large cats, sea lions, some dogs, and even in a few omnivores like badgers and orangutans. The two other pairs of muscles that act on the temporomandibular joint are the medial pterygoid and lateral pterygoid. Both of those are located deep to the mandible and originate on the pterygoid plates of the sphenoid bone. They insert on the deep surface of the mandible, so neither pterygoid muscle can be easily seen without removing part of the ramus of the mandible to expose an area known as the infratemporal fossa. Both the medial and lateral pterygoids can aid in side-to-side movements of the jaw, as in when performing grinding actions between our molar teeth. This is sometimes called lateral excursions of the mandible, which makes those movements sound awfully fun. Both pterygoids are also involved with protraction of the mandible, which means pushing the jaw out anteriorly, while retraction of the mandible is accomplished by posterior fibers of the temporalis muscle pulling the jaw back into place. Despite their location in and around the face, muscles of the jaw are not facial expression muscles and are not supplied by the facial nerve. All muscles of chewing are supplied by cranial nerve 5, the trigeminal nerve. Its third branch, the mandibular nerve, exits the cranial cavity to reach the infratemporal fossa, and this control of mandibular movements is one of the reasons for its name. Now, let's touch on temporomandibular joint disorder, commonly just called TMJ, but TMD is actually the preferred acronym. The causes are elusive and varied. It can occur after an injury to the jaw or the joint, from arthritis in the TMJ, or from long-term bruxism, that's grinding of the teeth. TMD can also arise from muscular causes, like stress that causes some people to clench their teeth too much. Sometimes an audible clicking or scraping sound occurs when they chew. Some individuals even have dislocation of the mandible or a locking of the joint that can prevent jaw movements. I know that physical therapy can help many people, as I've seen my PT students practice on each other using gloved fingers and mouths and so forth. Speaking of PT students, maybe it's time we got back to Kate's situation, the clinical correlation mentioned at the start of this lesson. Remember, she woke up one morning and the right side of her face was paralyzed. She couldn't close her right eye, and though she could open and close her mouth, she was still having difficulty drinking water. What was happening? For some of you, this condition might ring a bell, and there's a hint. Have you ever heard of Bell's palsy? Since it wasn't a single muscle, but the entire right side of Kate's face, what cranial nerve do you think may have been involved? I'll give you two choices: cranial nerve 5, the trigeminal nerve, or cranial nerve 7, the facial nerve. Yes, cranial nerve 7. Since all muscles of facial expression are controlled by the facial nerve, Bell's palsy is a condition of that nerve. And in Kate's case, it was the facial nerve on her right side. Since the trigeminal nerve supplies the muscles of jaw movement, she could still open and close her mouth. So why did she have water dribble out the right side of her mouth? That was because the buccinator muscle in her right cheek was affected, since it's also governed by the facial nerve. Though Kate was somewhat embarrassed by the facial asymmetry, the most medically problematic aspect of facial nerve palsy is the inability to close the eye on that side. Since the orbicularis oculi is affected, the eye can't blink. And blinking is necessary to distribute lacrimal fluid, better known as tears, across the eye to keep it moist. People with Bell's palsy often need to use artificial tears to avoid damage to their affected eye. The clinical name for Bell's palsy is acute peripheral facial palsy of unknown cause. As the name implies, the cause can vary or be unknown. Often it's from a virus that affects the facial nerve, such as an ear infection, since the facial nerve travels adjacent to the ear. But it can also be the after effect of another virus, including the common cold, flu, fever blisters, or shingles, mononucleosis, viral meningitis, or COVID. Bell's palsy also occurs more often during pregnancy or in those with diabetes. In most cases, it begins to resolve on its own in just a couple of weeks. And fortunately, that was the case for Kate. When she came back to class, I joked that developing the pathologies we discussed in anatomy was taking her homework way too far. Interestingly, dogs can also develop a form of Bell's palsy. And while they don't have the same range of facial expressions as humans, it is a disorder of their seventh cranial nerve and will affect their ability to close their eye on that side. In addition, their ear and lip on that side may be paralyzed or droop. This can occur more often in middle-aged or older dogs, but its cause is often unknown. Like in humans, it can follow a virus or an ear infection. But I've also heard that it can occur in floppy-eared dogs who are allowed to hang their head out the window of a moving car. Sources indicate that the flapping can be harmful to the dog's ears and can result in ear damage and perhaps even Bell's palsy. Other trauma to a dog's ears, including from abuse, can also lead to Bell's palsy because, as in humans, the facial nerve passes out of the skull near their ear. Okay, in the few minutes we have left in this lesson, let's talk about a couple of major muscles within the neck. There's a group of muscles known as the scalenes that originate on the transverse processes of cervical vertebrae and insert on the first and second rib. They flex the neck when used bilaterally, but if just one side is used, the result is flexion to the same side as the muscle used. Remember, that's called ipsilateral action. However, because the scalenes are attached to the first couple of ribs, if we keep our neck stationary, a really deep breath can allow the scalenes to raise the first couple of ribs. This is how we feel the very top or apex of the lungs, which are literally in the root of the neck. Sometimes in a yoga class, the instructor might tell you to take a deep breath, filling your lungs completely until you feel almost a separation of your clavicles. Because the clavicle rests on the first rib, the deepest inspiration can allow the scalenes to adjust the most superior aspect of the rib cage. In terms of innervation, the scalenes are so close to the midline of the body, where spinal nerves emerge from their intervertebral foramina, that there really isn't a name for their nerve supply. Small so-called segmental branches off the cervical plexus simply directly enter the scalene muscles. Finally, the sternocleidomastoid muscle is wonderfully named for its dual origins on the sternum and clavicle and its insertion on the mastoid process of the temporal bone. Remember, that's the bump felt just behind the ear. Because the sternocleidomastoid passes anterior to the vertebral column, when we contract both muscles, we flex our neck. But when just one sternocleidomastoid is used, it slightly flexes the neck and turns the face to the opposite side of the muscle used. Remember, that's known as contralateral action. Though it's a muscle of the neck, the sternocleidomastoid is supplied by cranial nerve 11, the spinal accessory nerve. That cranial nerve supplies only one other muscle, the trapezius, which is posterior to the vertebral column, as we'll see in our next lesson. You should now have a pretty good idea of the muscles of the head and neck, what they do, and which cranial nerves innervate them. In the next lesson, we're going to cover other important muscles that lie on the posterior neck and trunk, your back muscles, as we continue our journey of the musculoskeletal and related nervous systems.